Good afternoon, and thank you all for joining us. Today is Tuesday, November 16th, and on today's briefing, we'll hear from Mayor Tom Barrett, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Chief Health Policy Advisor with Milwaukee County, and Darren Rausch, Health Officer and Director with the Greenfield Health Department. Thank you all for being here, and Mayor Barrett, I'll hand things over to you to get us started.
Well, thank you very much, Catherine, and good afternoon, everyone. I'm pretty sure most of you and most of us have been reading over the last several weeks about the increase in cases in the northern part of the country and the western part of the country. And unfortunately, we are no exception to that rule. Throughout the Midwest, throughout Wisconsin, and here in Milwaukee, we are seeing numbers that are higher than they were just several months ago. And that means that we remain in the extreme transmission category for COVID cases per 100,000. And we still have that number as a very high number for us. So we have to do what we can to get that under control. We're at 196.7 cases per 100,000. Our positivity rate remains in the moderate transmission category at 7.5%. The number that, as I've said in earlier calls, and I'll say it again here, that I really want to see us increase is that vaccination rate. We are at 58.5% of city Milwaukee adults. That's individuals 16 or older who are fully vaccinated. 63.5% of adults have received at least one dose. That number has not changed significantly in the last several weeks. And this is an important time to make that point again, because as we head into the holiday season, everyone who is in this community can help us stop the spread of COVID-19 by receiving your vaccine if you haven't done so already. And if you're eligible for the booster, go get that booster. I want to talk a little bit about the Milwaukee Health Department, which continues to offer free COVID-19 and flu vaccines for adults and eligible children at our Northwest and South Side Health Center and Menominee Valley site locations. The COVID-19 vaccine is also available at the Health Department's weekly mobile clinics, including its school-based clinics. And we're really pleased that those are off the ground. Again, I would like to see more numbers, and not numbers. I'd like to see more people actually get the vaccine. But since the clinics began last Monday, nearly 520 vaccines have been given at school locations. The full schedule of upcoming school vaccination clinics is available at milwaukee.gov/COVIDAX. At-home vaccinations are also available, and this is for people who are primarily confined at home, but at-home vaccinations are available for individuals on Monday, Wednesdays, and Fridays. Those will be Pfizer and Johnson & Johnson vaccines only. So if you're interested in one of those, please call the Health Department's COVID-19 hotline at 414-286-6800 to schedule an appointment. The Bucks, well, I'd like to see them playing better too, but I think once we get a few key players back, we'll be doing better there. But this past weekend, we had an outstanding number of people attend our Bucks clinic for the chance to receive their COVID-19 and flu shots, and also to take a photo with the Larry O'Brien Championship Trophy. A lot of fun, a lot of people, a lot of fun. I know the lines were long, so I appreciate people's patience. The large number of people who showed up for the clinic is a positive sign that we are making progress on our vaccination efforts, especially among our newly eligible younger residents. Over 300 COVID-19 and 70 flu shots were given, 159 of which were pediatric vaccinations. The Health Department's second vaccine clinic in partnership with the Bucks will be held on Saturday, December 4th. So again, a couple of weeks down the road, come on back down and get your vaccination and bring your kids to get them. Attendees can receive first, second, and booster shots of COVID-19 vaccine as well as flu shots. And there's more, there's even more, because participants will be eligible to enter into a ticket raffle for the game that night. So again, come on down, get the shot, and enter a ticket raffle for the Bucks game that night. Finally, I want to inform our business community that the city will be extending our Active Streets for Business program that allows restaurants and bars to utilize sidewalks, parking lanes, and travel lanes for expanded outdoor seating. As you may recall, we instituted this last year, really when we had the first wave of COVID-19 sweep through the community. We felt it was important to help our businesses, our restaurants and bars as much as we could. And that's why we had that extension of our Active Streets program. The program this year was scheduled to sunset on November 15th, but we have extended it through the winter. The program is a no-fee citywide program. Since its launch in June of 2020, the program has proven popular with patrons and the business community. I think it's because we've got a lot of hardy people here in Milwaukee, and they can handle the weather. The winter guidelines again include allowances for tenting and heating during cold weather. Current participants in the program can email their DPW permit contact for an extension, and full guidelines can be found at milwaukee.gov/DPW. We are looking forward to seeing the creative seating options for patrons outdoors again this winter. But I think, as we all know, what we want to see more than anything is we want to see an end to this COVID-19 pandemic and get life back to normal, but we're not there yet. But we appreciate the partnership with the county. We appreciate the partnership with all the medical providers, and we know there's work to be done. We're going to continue to do that. So with that, I'm going to turn it over to Dr. Weston to get his insights. Dr. Weston.
All right, thank you, Mr. Mayor. Good afternoon. First to our numbers, we're currently seeing in Milwaukee County an average of 256 new cases per day and about 3 deaths per day. And our trends are once again going in the wrong direction. In 2 weeks, our cases have increased by 50%, and our positivity rate has increased from below 6% up to 8%. When we look at the rest of the country, we're seeing similar trends, especially in certain pockets. When we look more broadly at the rest of the world, particularly in Europe right now, we're seeing skyrocketing cases, in some cases beyond any other point in the pandemic, particularly in countries like Germany, where vaccination rates are quite a bit higher than what we have here in the US. We've seen firsthand the interconnectedness of the world with COVID, what happens in China, in the UK, India, or Eastern Europe affects us, and it also predicts what will come our way. So with that as a background, we're fast approaching Thanksgiving and the beginning of the winter holiday season. And with COVID on the rise, this can lead to many challenges for families looking to gather, as well as those avoiding gatherings. And for many, it's easy to feel that everyone has returned to life as normal, while you're still taking COVID precautions. But it's important to know that you are not alone. An Ohio State University survey found that about 50% of people plan to ask their guests about vaccine status. 50% plan to require a negative test before gathering, and about 50% plan to ask guests to wear masks. So with that in mind, how can you increase the safety of your gathering? Well, as a starting point, there's clear CDC guidelines. Now, these are expert-defined guidelines that can help us to better decide what activities are safe and what may not be. So regarding travel, the CDC recommends postponing travel, particularly interstate travel by plane, train, or other public means until you're fully vaccinated. And that's for adults or children. And the CDC also recommends avoiding mixing separate households of unvaccinated people. And that includes unvaccinated children. Now, while many people will follow these guidelines to maximize their safety, we also realize, we know that this may not fit for every family. But you can still work to maximize the safety of your event by using as many layers of protection as possible. Now, the best layer of protection, of course, is the vaccine. Ensuring that everyone who's eligible at your event is fully vaccinated, and that the children who are 5 to 11 who are newly eligible have received at least their first dose of vaccine as far out as possible from that event is a critical element to increasing safety. Now, while masking, distancing, and ventilation are vital measures to prevent the spread of COVID, they can be challenging in indoor family settings. Now, you could and should consider masking those who are above the age of 2 who are not fully vaccinated as much as possible. And one other measure that may be particularly useful for these gatherings is testing. So with the wider availability of cheap, at-home, over-the-counter testing for COVID, as well as many testing sites across the county, it's fairly easy to add that additional layer of protection, especially if the test is done the same day as the gathering. Now, none of these layers provides 100% protection, but when added together, you can make your gathering far safer than it otherwise would be. It's important to remember that for many people out there, whether due to following guidelines for maximizing safety or due to conditions or medications that make them more vulnerable to disease, This holiday season can be particularly difficult with increased isolation and loneliness. So as you plan your holiday, consider those around you. Family, friends, neighbors who will not be able to gather with others. Reach out to them, give them a call, drop off a meal. These simple gestures can make a world of difference. Finally, shifting, I'd like to invite everyone to participate in the free, family-friendly Fact or Cap virtual game. It's tonight from 7 to 8 p.m. This is an online trivia game show, tests your family's knowledge of health and COVID. There's cash prizes, there's live entertainment during the game as well. So you can go to healthymke.com/fact-or-cap, CAP, for more information and to register. And finally, please, please, please get your child protected by getting them vaccinated against COVID. The vaccine is safe, it's effective, and you can also visit healthymke.com to find a site near you. Not all sites are vaccinating 5 to 11-year-olds, so take a look at the website and figure out who's vaccinating that age group. Thank you and stay safe, and I'll hand it to Health Officer Roush.
Thank you very much, Dr. Weston. It's my pleasure to join today to talk a little bit more about COVID cases and case rates in our community. A few quick slides I want to share today just to kind of give a sense of where we are. As Dr. Weston mentioned, we're carefully watching what's happening in other parts of the globe, Germany, Europe, and others, but certainly we also want to be cognizant of what's happening here in our backyard as well. So as we mentioned in the data that was released last Thursday, we started to see an inflection of cases moving up late last week. And what you see here on the screen is certainly that. We're starting to see increases in the 7-day average for City of Milwaukee in the orange line, as well as in the suburban communities in the blue line. And granted, we're not where we were in September, but we certainly still have plateaued, at least recently, at a very high level that's much different than it looked like back in June and the early part of July. When we look at these data, looking at kids, we certainly aren't where we were again back in September, but the increase is much sharper, particularly in the city of Milwaukee, and it's something to watch. We know the most recent data is tentative and draft data only as more results come in, but that's certainly something we want to watch. Is this a trend back up, or is this just a small blip that we're going to see in case rates? Additionally, today I wanted to share what's happening at the state level, because I think the picture at the state level is a little bit different than what's happening here in Milwaukee. So on my screen here, you see the new COVID cases by date confirmed in the 7-day average. And you can actually see that in recent days here, we have seen more COVID cases in that particular day than we had seen in the previous peak in September. And certainly that 7-day average of 2,862 cases is at or close to where we were in September. So we need to kind of watch all of these things. And then lastly, I'll just show what we're seeing at the CDC. And this is a map of the states in the United States. And actually our neighbor to the west, Minnesota, is currently one of the highest COVID burden states in the country. And so if you look at this map, all of the very dark blue states are areas that have high levels of transmission, Wisconsin, Michigan, Minnesota being one of them, but also some of the other high plains states. So collectively, we need just to be cognizant of the fact that while we've seen some decreases, we might now be seeing some increases in cases. And that doesn't necessarily bode well as we get into the Thanksgiving and Christmas holidays over the next month and a half. But with that said, as Dr. Weston mentioned, there are a lot of great resources for you to get vaccinated. You still have an opportunity to get kids 5 to 11 vaccinated within the next week to give them that full protection before the Christmas holidays. Thanksgiving is a little bit more difficult or impossible for kid vaccinations, but certainly you as an adult who may need a booster could get fully vaccinated and boosted prior to Thanksgiving. So again, want to share the sites that we've shared before. Healthymke.com, vaccines.gov are great sources for you to identify vaccinations, whether they be at local health departments, clinics, other nonprofits, healthcare settings, federally qualified health centers, or pharmacies. And so with that, I'll turn it back over to Catherine for the question and answer portion.
Thank you, Director Roush. I do not have any questions in the chat at the moment, so I will just give it a quick minute to see if we have any questions.
It's a wrap. Oop.
We have a few questions coming in here. Okay. Melissa Zagowitz with CBS 58 is wondering, do we know how many breakthrough cases there have been?
We do. The DHS has a tab that is dedicated to breakthrough cases. You can see breakthrough hospitalizations and deaths as well.
We did have another question from Allison Durr for the mayor. She's wondering, Allison Durr with the Milwaukee Journal Sentinel, she's wondering, with President Biden having signed the infrastructure bill, does the city know how much it will receive? And if not, when the city will have that information?
We don't have that information right now. We'll get it to you as soon as we know it. But we're very, very excited. This has been an incredible achievement, and it's a win, obviously, for President Biden, but I view this as more a win for communities around this nation that need to improve their infrastructure. So we're very, very excited, and we're very thankful for his leadership on this.
Another question here coming in. Terry Sater with WISN 12 is wondering for Dr. Weston, are the at-home COVID tests accurate?
So that's a great question. There are many different at-home COVID tests, not to promote one brand over another, but the one that seems to be most widely available and seems to be cheapest is the Binax Now. I think it's about $5 to $10 a test, depending on where you get it. And it's a pretty good test. It depends on whether you are symptomatic or not. So people who are symptomatic, it's around 60 to 70% accurate. That does drop with people who are not symptomatic, but it is just about 100% sensitive. So what that means is if you have a positive test, you can be pretty sure that you actually have COVID. If you have a negative test, you can be fairly confident that you don't have COVID, but not quite as sure. So I think what the utility of these tests is are doing same day tests for your event in the case of Thanksgiving or other holidays. So that morning, have everybody at your event do one of these tests. If anybody comes back positive, they're not coming to that event, and people who are exposed to them shouldn't be coming to the event either. And they should presume that they have COVID. But if everybody's negative, it's not 100%, but it's another layer of protection on top of the vaccination, on top of the other things that you're doing.
So Catherine, I can jump in on this Jason Kelly question. Obviously, we've been monitoring the trial in Kenosha. The police department has been monitoring the trial. Our police department is prepared. There are no plans right now to call in the National Guard, and I don't foresee them right now. But again, I've been in contact with the police chief. In fact, I talked to him just 20 minutes ago. So we're monitoring this, and we hope that whatever happens, it will be peaceful.
Thank you, Mayor Barrett. Those now are all of the questions I have in the chat. So that concludes, do we have one more question here to conclude the briefing? It's a good one. Terry Sater with WISN 12 is wondering, there are still a lot of people wondering if everyone in a family is vaccinated. Is it okay to gather for the holidays? Any thoughts for our health professionals?
So if I understand the question right, it's if the whole family is fully vaccinated, is it okay to get together? I think probably the answer is yes. I would keep the group relatively small. If your family is, 40 people of all sorts of extended family, you're just increasing your risk because there are still breakthrough infections. Even though the vaccine protects you, there can still be breakthrough infections. So I would still keep the group relatively small. Certainly, if anybody has any symptoms, they shouldn't be gathering. And then that at-home testing is another layer of protection to add to that, just to make sure you're minimizing that risk and minimizing the likelihood of any breakthrough infections there. And sorry, one other point just to add to that that came to mind. So when we think of fully vaccinated, we're thinking of 1 dose for J&J, 2 dose for the mRNA vaccines. But you can also have that added protection by boosters. If people are eligible for boosters, certainly have them get boosted before holiday gatherings. It really does ramp up that protection that they have if they're eligible and due to get their booster.
Thank you, Dr. Weston. That does conclude our briefing for today. Thank you all for the great questions. Thank you for joining us, and we will see you next week.
Thank you all.
Thank you.